The medical establishment has completely dismissed a drug that doctors all over the world are now successfully using to treat COVID patients. It's not just hydroxychloroquine, but dozens of therapeutics that are far safer than a vaccine that we still don't know a lot about. Is that true? Well, joining me now is Dr. Peter McCullough, internist and cardiologist. He's been spearheading efforts to get this countervailing perspective in front of Congress. Dr. McCullough, you say that we call it the medical establishment, big med, are engaging in what you call therapeutic nihilism. Explain that.
Well, Laura, thanks for having me on the show. And let me say my opinions are my own and not necessarily those of my institution. But boy, November 19th and today, December 8th, 2 big days, Ron Johnson in the Senate subcommittee hearings, important informations for Americans. And what we've learned is that there has been a prevailing view or therapeutic nihilism, or nothing can be done for COVID-19. But what we've learned is what we call sequential multi-drug treatment for early COVID-19 in patients at risk over age 50 or with medical problems with 3 layers of medicines: anti-infectives, corticosteroids, and then antithrombotics or blood thinners, has a marked improvement in outcomes, can reduce hospitalizations by 85%, cut mortality in half.
Well, and I think we know now, in looking at the language, that in order to get emergency use authorization for these vaccines, it can't be that there are safe therapeutics that show effectiveness against this particular virus. That's one of the requirements for the emergency use provision. So you kind of couldn't have hydroxychloroquine working or ivermectin or steroids or a combination, correct?
Well, EUAs really aren't needed for available drugs that can be used in appropriate off-label use. So it turns out that ivermectin, hydroxychloroquine, we heard today about favipiravir, which I think, honestly, we should have brought into the United States very early on. It's used in Russia, India, China as a direct oral antiviral. But one of those 3 drugs paired with doxycycline or azithromycin, that covers the anti-infective layer. We started
right, but what we're saying, Dr. McCullough, is that there was a campaign, a concerted campaign to vilify and dismiss and demean and frankly lie about the effectiveness of these drugs. There's nothing else to call it.
Well, I mean, Laura, to be honest, if you go back in history, this is not uncommon in pandemics. There's such fear, there's such anxiety. There's a few people who step to the front and are real leaders. And what we heard today, we had 6 leaders who have innovated with their protocols, and they presented them from Milwaukee, from Florida. They're clearly keeping people out of the hospital. There's many that step to the side, and then there's some that are always in the back that are detractors. And what's happened is there are some detractors in medicine.
Yeah.
More people are coming on board. Patients are being treated. The American Association of Physicians and Surgeons has a patient guide that's available. It supports doctors in treating patients. And if doctors are uncomfortable in working with these medicines, now there's telemedicine networks that will step in and treat large numbers of patients.
You still have pharmacies and pharmacy boards being threatened, doctors not allowed to prescribe or being hassled for prescribing certain of these antivirals or therapeutics. But that hearing today, Ron Johnson deserves 3 gold stars for bringing those great experts to the field so people could actually hear them. Doctor, thank you so much.